I'd like to take a moment to share with you a little bit about the different phases of pain. A lot of people think no pain, no gain. But it's important to be able to discern and differentiate between the different types of pain, because not all pains are good. So when we look at fascia, for example, a few different characteristics might include itching, which is often a sign that there's repair underway, or it might be burning, which is a sign that it's being sheared off a little bit faster than it would like to, much like Velcro, where those filaments peel and pull off each other before finally letting go. That's like your nerve endings getting tug, and then finally released. And then there's also ticklish. That's an indication that you have very tight fascial restrictions. As far as muscle goes, one of the indicators could be dull, achy. As far as your bones go, a deep, boring, almost penetrating kind of sensation through your tissues might be elicited, so like a boring pain, a penetrating pain. And then when we look at nerves, there's numb and tingling, which is usually an indication more like a chronic long-term compression of a nerve. So a common one is down into the arms, the ulnar nerve being the one that if ever you feel numbness tingling into your pinky and ring finger, often that's a compression of the ulnar nerve, which can, in many cases, especially with office workers where you're more compressed forward, could be an indication that you're getting a compression through pec minor near the brachial plexus here of that nerve. And another characteristic of nerve pain could be sharp shooting. Sharp shooting is usually an indication that you're getting really acute, meaning very in this moment right now, a compression or a zing on a nerve. And sharp shooting pain is always something you want to back off of. You definitely don't want to push through that. And then when it comes to blood, a cooling sensation, because blood is warm. It runs through your body very deep. So for the most part, is at what we would consider core temperature, about 37.5 degrees Celsius. And so it makes sense that the more blood flow you have in an area, the warmer that area is. The less blood flow you have to an area, the colder that extremity is going to be. So something to keep in mind is check in with the quality of your pain. Is it burning, itchy, tingly, ticklish, which would indicate more fascia? Or is it dull, achy, more muscle? Is it sharp shooting or numb and tingling, which is more nerves, as I mentioned? Or is it more cooling? So just a few things to keep in mind. So check in with yourself and hopefully listen to your body. We don't want to cause more damage unnecessarily. Here we are, going down the Colorado River in the Grand Canyon. We're just a mile from what's known as Elves Chasm, and this place is absolutely spectacular. See you later.